Together we achieve victory over heart failure.
Hello everyone and welcome to our podcast. I am Dr. Ashootosh Bhardwaj and currently practicing cardiology in Chandigarh. We should know that today we are delving into a silent epidemic that India is combating, aptly known as heart failure. In India, the majority of patients grappling with heart failure are surprisingly young individuals. It's a common occurrence to witness young adults seeking medical assistance for heart failure, unlike the Western countries where heart failure is predominantly a disease of the elderly. So let's break down 5 essential insights on heart failure. Firstly, let's see what does it mean when a doctor tells you that you have heart failure. When people get a diagnosis of heart failure, they usually think that it's the end of their lives. The term heart failure can seem frightening, but actually it simply means that your heart is struggling to pump blood as efficiently as it should. The ejection fraction or EF measures how well your heart pumps the blood. It is the amount of blood pumped out of your heart's lower chambers, called as ventricles, each time the heart contracts. While a normal EF is around 50 to 70%, individuals with heart failure typically have an ejection fraction of 40% or lower. It may be in the normal range also, but typically they have an EF which is less than the normal range. Secondly, let's see why are so many Indians affected by heart failure. Among the Indians, the genetics plays a significant role. Indians are genetically more vulnerable to cardiovascular diseases. Furthermore, hypertension, that is high blood pressure, diabetes, obesity, that is being overweight, smoking and alcohol habits worsen this epidemic. Moving on, let's see what are the signs and symptoms of heart failure. So you should watch out for confusion, fatigue, heart palpitations, nausea, shortness of breath, weakness, maybe loss of appetite or vomiting. There may be swelling in the feet or you may feel pulsations in the neck. So these are the signs and symptoms to be watched out for heart failure. So let's see how can we protect ourselves from this disease. We know that our hearts work incredibly hard to keep us alive. There are 5 golden rules which we can follow to return the favor. So the first is early detection of heart failure through regular tests and visits to the physician. Patients who are at high risk of heart failure are patients who have obesity, that is, who are overweight, who have hypertension, that is, high blood pressure, those who are diabetics and blood sugars are uncontrolled, those who have coronary artery disease, that is, blockages in the arteries that supply the heart muscle, then people who take a lot of alcohol. So these patients are at high risk of heart failure and they should definitely consult a physician or a heart specialist so that heart failure can be diagnosed early and most importantly, it can be prevented so that it does not occur. The second is dietary adjustments to maintain heart health. So you should try to reduce the amount of fried food, decrease the amount of added salt, that is the salt that you put over your salads, fruits, curds, etc. This should be reduced. You should reduce the amount of preserved and packaged foods also. Foods which are helpful to keep the heart healthy are fresh fruits, vegetables, whole grains. Particularly beneficial for the heart are few fruits like amla or the gooseberry, anar or pomegranate, and papaya or papita. So these fruits should be a part of the daily routine in patients who are at high risk of heart failure, as we have already discussed. Then comes the role of exercise. Incorporating daily exercise in your routine will help prevent heart failure. The best exercise that prevents the heart failure is yoga or pranayam, but it should be learned from a learned person only. Then comes the role of stress management. Practicing stress management techniques via yoga or meditation also helps to reduce the incidence and decreases the complications of heart failure. Lastly, but most importantly, quitting alcohol, tobacco, and smoking are an important part of the lifestyle to prevent the onset of heart failure as well as to decrease the complications of heart failure. Coming to the last point, so what comes next after a heart failure diagnosis? Thankfully, medical science offers numerous treatment options, and it is possible to lead an enjoyable, meaningful, and productive life after a heart failure diagnosis. Heart failure medications improve the quality of life and longevity. Devices like a biventricular pacemaker, ICD, or heart wall repair or replacement can be done in patients who are refractory to medical management. And as a last resort, the option is to have a heart transplant. But it is important that we prevent the onset of heart failure, and if heart failure occurs, we prevent the complications of heart failure. The lifetime risk of CHF or heart failure is 1 in 5 for both men and women. Always remember that awareness and proactive measures are the key in combating this silent epidemic. So let's make the society and our nation healthy by preventing the onset and preventing the complications of heart failure. Thank you.